We all know the basics when it comes to keeping your teeth white and healthy, like brushing, flossing, and seeing a dentist twice a year. But some habits and lifestyles could be harming your smile.
And joining us to talk about bad habits that wreck your teeth is Dr. Julia E., a general dentist at North Miami Dental Group. Okay, let's get right to the point. I want to talk about habits to avoid. We all have them. So what are those?
Yes, exactly.
There are a few. One of the biggest things, smoking. Smoking is no good for your teeth. It's no good for a lot of things in your body, but any healthcare provider is going to tell you smoking
Big no-no.
is just a big no-no. With respect to your teeth, it can affect your gums. It can cause that dark staining. I mean, nobody wants that. Another thing that's very common is things like sucking on lemons.
People do that for fun.
People do that. People suck on it like this, and it's very acidic. So you're really just putting acid directly on your teeth regularly, which breaks down that outer tough layer of your tooth, the enamel, which everybody's heard of in toothpaste commercials, this and that. That's like, I like to think of it like an egg.
Right.
You know, the outer shell is the enamel, which is the hardest layer. That's your defense against cavities, against whatever. The second layer, like the egg white, is like dentin, which you might have heard of too. That's the next layer under. That layer is a bit softer, a bit more sensitive, but it's not exactly like the nerve. The nerve, let's say like the yolk, is the most susceptible. It's the nerve in your tooth, and we call it the pulp. So as you get in, things get easier to penetrate as a cavity
More
or bacteria.
sensitive.
So when you do something acidic, like a lot of people are into apple cider vinegar right now, you know, anything like soda is very acidic. That's really affecting the outer enamel, tough layer of your tooth. So it makes you a lot more susceptible to getting a cavity.
And there's no way to build that enamel back up once it's gone, right? Correct?
No, I mean, you can, things like fluoride, let's say. Fluoride actually replaces a ingredient or a element of your enamel, and it makes it stronger against cavities. But you can't really build it back up. So if you ever see people with like little yellow kind of pits on their teeth, it's a lot of the time acidic problems. So some people have gastric reflux, so we can see that in their teeth.
Right.
Things like that.
What about things like chewing ice? I mean, here in South Florida, we're big coffee drinkers. I
Yes.
personally drink tea, red wine. Are those bad?
So coffee is acidic, you know, but you can't really skip coffee.
Yeah. You lose your teeth before you skip
Yes,
off.
you lose your teeth before you skip the coffee.
So you get staining from coffee, you get staining from tea, you get staining from red wine. I mean, a lot of people turn to whitening for that. You can also just brush after, but it will accumulate. Straws are a big no-no right now, but if you have your reusable straw or your paper straw, whatever, you can drink your coffee with that. It's not the most comfortable thing to drink a warm coffee with straw, but I mean, if you're gonna save your teeth from the staining, it depends on what you care about more. Whitening is great for that though. You know, there's the at-home whitening, there's the whitening in office. It's kind of the same ingredients, but in office you're gonna have it at a much higher concentration than what you could buy in the store. So, you know, those white strips versus the in-office whitening where you're in the chair and there's the light, it's a much different result. At home you're gonna get, let's say, 1 to 2 shades whiter over maybe a month. In the chair, you're gonna get 3-4 shades whiter in an hour.
Wow.
It's a lot stronger. And then maybe you can maintain it at home if you're a big coffee or wine drinker, things like that.
Let's talk about maybe some mistakes parents might make with their baby. For example, when they put the baby to sleep with the bottle in their mouth and they leave it all night. Is that?
That's a big no-no.
I was guilty of that. Thankfully, we lost no teeth, but my niece lost all her front teeth because of the decay of the milk. Is this true?
So the milk is just like a little breeding ground for bacteria because it's something acidic that breaks down your teeth, but also, you know, the bacteria is sitting there, and it's not just like water. It's, you know, there's different things in the milk that the bacteria want to eat, and it's just sitting on your teeth all night, or on the baby's teeth all night. So that leads to really quick decay. Exactly what happened to your niece. All those front teeth have to come out.
But if they don't have teeth yet, is that affecting the gums or future?
Yeah, that's a good question.
It's more of like a habit thing. Another thing is, you know, kids are developing, babies are developing, so your palate, the top of your mouth, it gets affected by things like thumb sucking or sucking on a bottle for too long, for example, or a pacifier. Kids should stop using pacifiers around age 1 or 1.5. Otherwise, the palate, the roof of the mouth, doesn't drop into place where it should be, and that can cause developmental problems that the child will have for the rest of their life.
Like sucking their thumb
Like
when they
sucking their
push
thumb.
their teeth forward. And your
Their
adults
teeth-
still have that.
Exactly, they have an open bite. So when they're biting down, the front teeth still have a space between them. That's called an open bite.
Okay.
But what you don't realize is when you look at the roof of the mouth, it's actually going to be high too. So those are really important habits that parents need to watch out for in their kids. And they have, if the child really won't stop, they have appliances that kids can have, but there are little tricks, like they have little things you can paint on the kid's thumb and it just tastes bad if your child's a thumb sucker.
I cut all the pacifiers, all the tips of the pacifiers, all the ones that I had hidden as backup, and that was the end of it.
worked.
It
I
was
mean,
so scary for me, you know.
It's hard because it's so comforting for your kid and you don't want to take it away from them. But the long-term repercussions, I mean, you got to weigh it out and they'll toughen up from it.
That's true.
And when the kids grow up, some of them pierce their tongues.
Oh, gosh, no.
Is that
Oh my gosh,
an issue?
that's a dentist nightmare. So, I mean, there are so many problems. People chip their teeth. So much bacteria can get in there. People can get really bad infections from that. And it's just...
In the tongue?
Yeah. It has, I mean, it's a big no-no.
It's a big no-no.
No.
Kids out there, it's a big no-no.
Yeah, don't do it.
I mean, what about sugar? I feel this is a tough, especially with Halloween coming around the corner,
It is
and now
tough.
we got all the candy, and you don't want to be that mom that takes all the candy away.
Yeah.
But how does sugar affect the teeth, both in kids and adults, really?
So I'll explain it to you how we explain it to our young patients.
Please.
So you eat the candy, right? And it tastes great. There's sugar, you know, maybe it was juice, maybe it was like crackers, but there's sugar in it. And that sugar is gonna sit on your teeth because you didn't brush it off right away. And then we call them sugar bugs. Your sugar bugs are gonna go eat the little candies that are left on your teeth because they like it too. And they're gonna poop out little bugs
Well, that's a way to sell it. I mean,
Boom.
you're selling
that
it
are
to
going to
me.
eat away the tough layer of your teeth. And that's how you start getting cavities. You get the sugar bug poop eating away your teeth. And that's how you get cavities. So that's how we encourage kids to brush the sugar bugs off. You don't want their poop all over your
You
teeth.
may have to do that to the adults as well.
Exactly.
I do it, but in a different way. I explain it to them in a way that says, you know, I tell them, whatever you're eating is staying on your teeth. You know, the bacteria is going to eat away at it, and it's going to cause decay. It's kind of like a peach, you know. When a peach starts getting rotten, it gets soft, and then it just starts going really fast once it's started. It's the same thing with a cavity.
If I were to open a bag with my teeth, like to get something out, is that probably not a good idea? I gotta stop that.
I don't think that people
Or
should
you're gonna
do
have to
things
go
like
see
that with
Dr.
their
E.
teeth. Or when they open beer bottles with their teeth.
You do that? Kathy?
No.
Okay, good.
But you know, you're gonna get chips. You're gonna wear away your enamel, that tough layer of your teeth again. So, you know, when people get that little chip, most common thing I see is like 20, 30-year-old guy and they have a chipped tooth. Oh, how did that happen? In college, I either got in a fight, I was opening a beer bottle, I hit it with a bottle. Super common. But now they have that chip for the rest of their life. And you can keep fixing it, but there's not a ton to hold on to. So a lot of the time those need to be redone. Or in the end, the patient needs to get a crown, which is like a full coverage cap. And I mean, you want to do the least things you can to your teeth, obviously. And the cap will look great, but front teeth are really hard to match. It's never perfect, so, you know, those are things to avoid for sure. Or like people who open a bobby pin with their teeth.
I do that.
You see a little notch. You can see seamstresses, they bite pins there. You'll see a little notch starting to develop. People who chew pen caps, bite their nails. Over time, it wears away.
All right, I'll stop chewing my microphone.
Yeah.
Doctor, thank you for joining us.
Thank you for having me.
Thank you.